Thank you very much, Excellencies, colleagues. Thank you very much to the organizers for inviting us to present this paper this morning on reproductive, maternal, newborn, and child health evidence for action. I'm going to talk about the magnitude of the problem, working in partnership, the global strategy for women and children health from the UN Secretary General. We know what to do, regional commitment from a meeting that just finished yesterday in the Asia-Pacific region, and end up with some conclusions. You have seen some of these figures before in terms of maternal mortality. The maternal mortality ratio, while it's decreased, is still unacceptably high and distributed in a number of countries as shown in this map. We know what the causes of mortality are. A large percentage of them are hemorrhage, postpartum hemorrhage, that can actually be prevented and managed. And you have all of the other causes in this pie chart. Under child mortality rate, we also have very high levels of mortality. There have been a decrease, but we are still at about 6.7 million children dying, largely from causes that we know how to prevent and treat. Some of these causes are also very much caused by the underlying problem of malnutrition-related factors. The Countdown to 2015 is a group of institutions that are tracking progress in 74 countries with the highest mortality, and they have been looking at progress towards the Millennium Development Goals. So you see on the left-hand side on Millennium Development Goal 4 and the 5 mortality of the countries that were studied, there are 22 that are on track, 39 that have done insufficient progress, and 13 that have done no progress. This is significant because we are talking about the year, we are almost in the year 2013, and 2015 is just around the corner. On the right-hand side of the slide, you see the same information, but on maternal mortality. 9 countries are on track. 40 are making substantial progress. 16 no progress at all, insufficient progress, and 9 no progress at all. So we do have countries that have been making progress and countries that are very much behind. I will try to focus, and I hope the panelists, on some of the successes that have actually made some of these countries be either on track or making progress. One of the issues, once you start in a way providing interventions for mothers and children for reproductive health, is that the epidemiology changes, and therefore there are some other problems that start cropping up. For example, the issue of being born too soon. 15 million babies are born too soon every year. They are premature, they are preterm, and the rates are rising. They are increasing for a number of reasons. 14% of global child deaths are among premature babies. They are born too early. They don't yet have the characteristics to be able to fight disease and others. And premature babies can be saved now with feasible and cost-effective care, and programs need to be implemented and scaled up. The same thing with syphilis. Syphilis is not a new disease, but look at these figures. That increases the rates of stillbirth and also of neonatal death, as well as providing blindness in newborn children. We know how to deal with this infection. We know if we are able to identify it. And in the Asia and Pacific regions, there are countries that have reduced their under 5 mortality rates by more than half. So what are these factors of success, and how can we bank on those? The UN Secretary General launched the Global Strategy for Women and Children Health and the Every Woman, Every Child initiative in September 2010 in order to learn from countries that have actually made progress, and especially now that we have so little time between now and 2015, and the figures for mothers and children and for reproductive health are the MDGs that are not going to be fulfilled if we continue without specific action. He's talking about the fact that we know what works, how can we actually ensure universal access to essential health services, to interventions. Talking about the leadership, the political leadership is there. The highest level of governments are actually committed, and you heard yesterday the very important interventions that were made in this place. The issue of health workers' access, interventions, and also on accountability, which is basically telling us, are we actually do what we're supposed to be doing? The key elements of that strategy are not to be a global program, but actually to stimulate country-led plans on comprehensive packages of essential interventions, integrated care, for example, with HIV, AIDS, malaria, and tuberculosis, among others, strengthening health systems, both in terms of what the systems can offer, but also from the community side, the demand for these systems. And the issue of health workforce capability building, which is one of the difficult issues when you're talking about decentralization. Do you actually have the health workers that are required to implement the programs where it's required? Then the issue of coordinating research and innovation, a lot of work going on mobile technologies and on technologies to improve training, management, and even financing of healthcare, and the issue that I mentioned on accountability at all levels. So this is a very ambitious initiative that started to save 16 million lives. The government of Nigeria recently, 3 weeks ago, just launched, as part of the EWEC, Every Woman, Every Child, an initiative to save 1 million lives. What we did at the Partnership for Maternal, Newborn, and Child Health was to track some of these commitments, because there were quite a lot of commitments that were done, and we produced 2 reports, 2011, 2012, to see where they were. In 2011, there were over 200 commitments done to the global strategy. Some of them are financing, some of them are health systems, some of them are in terms of policies to improve health services. And this was not only by ministers of finance. There were NGOs, the private sector, healthcare professionals who committed. For example, in the case of Bangladesh, the commitment was to train 3,000 midwives to be deployed in the countryside. A quarter of these commitments came from low and middle income countries. And the message that I want to leave here is that for us to move forward, we have to be working with other constituencies. I think that was raised yesterday. Not only donors and foundations, but also with the private sector, with NGOs, academic research and training units, with partner countries, multilateral agencies, and with the healthcare professionals. This is the way that we work with over 500 members of the Partnership for Maternal, Newborn, and Child Health. So what was done with these partners was to synthesize the interventions, essential interventions, and commodities and guidelines. So we actually do have that information very well spelled. We know what to do. The interventions are there, and they are not only interventions at the health center, family planning advice, for example, preventing and managing sexual transmitted diseases, adolescent programs, interventions to cease smoking, support, social support during childbirth. So there are a number of interventions that are beyond what we traditionally called the health system, around adolescent and pre-pregnancy, pregnancy, childbirth, postnatal, and infancy and childhood. The problem is that while we know which interventions need to be implemented, the coverage of these interventions currently is very low and unequal. Equity matters, because if you look in this graph, the difference between the poorest, the red dots, and the richest, the purple dots, on coverage of some of these interventions. For example, on the left you see demand for family planning satisfied is about 30%. So you have a 30% difference between the rich accessing the demand for family planning satisfied, and the poor. And the same happens across the continuum of care. Skilled birth attendant, 90% of rich populations have a person who knows what the complications are and how to do the birth. 25% of the poorest population. So there is an inequity element in here that I wanted to point out. The second one is on context matters. So the human resources, severe human resources shortages are important, are key. Some countries that have been able to make progress have been able to either train more health workers, like the case of Bangladesh I mentioned, or task shift the work that these workers are actually doing. Contraception, we talked about this, lower in rural areas than in urban areas, even though it has improved with time, lower in uneducated populations, and lower in poorer populations. There were some initiatives that were mentioned yesterday on addressing RMNCH, the Child Survival Call for Action, the Family Planning Summit, and the UN Commission on Life-Saving Commodities for Women and Children. And for the family planning, we are talking about reaching 120 million women with family planning by 2020, as it was also briefly mentioned at the launch of the book this morning. This actually comes at the point in which we are still having to argue, especially with ministers of finance and with international donors, about the importance of investing in women and children health. That's still not quite necessarily there. We have to talk about that healthy women are more productive, that maternal and newborn deaths slow growth, leading to annual global productivity losses of $15 billion, that essential health care prevents illness and disability, saving billions of dollars. So we have to talk the language of those who are supporting these programs in order to be able to get them funded. And also, that is an issue of human rights, that people are entitled to the highest attainable standard of health. And the other point that I really wanted to face here is the issue of adolescents. We have over 1 billion adolescents, and this is the right time for investing. The private sector, very important to work with the private sector. A large proportion of commitments to the global strategy were from the private sector. I think the importance is that we can learn from the private sector a lot, innovation capabilities, how diverse sectors of the industry can support RMNCH programs. And the parliamentarians, and I believe there are some parliamentarians at this meeting, the crucial voice that they have, the parliamentarians, to legislate, to ensure universal access to essential care, for doing budgets that make sense and that there are line items for reproductive, maternal, newborn, and child health. I just came from a meeting in the region of the Asia Pacific that finished yesterday, and it was basically looking at investment, implementation, advocacy, and accountability. The key of this meeting was that there were over 200 participants, and we brought all of the different constituencies to discuss what we just talked about: ministers of health, finance, planning, parliamentarians, UN, healthcare professionals, civil society, and the private sector from the Asia, Southeast Asia, and Asia Pacific regions. They came with action plans and next steps for that particular region. That is a region that has had a lot of innovation, that has had a lot of progress, but still has some countries that are lagging behind. They were talking about accelerating action, tackling disparities, focusing on equity, maintaining the continuum of care, working from adolescence all the way to childhood, innovation with technologies, also integrating existing health programs and going beyond the traditional health systems, broadening partnerships, including the private sector, but also with civil society and parliamentarians, and encouraging grassroots innovations. And the declaration, which can be found in our website and will be distributed subsequently, is basically one page that talks about investing and acting, sharing and learning across countries, integrating and innovating, and promoting accountability and rights. To finish, I would just like to conclude to say there's been progress that has been made, but if we are actually going to talk about the MDGs or ICPD 2014, much more progress is required. Equity-focused approaches are essential for RMNCH. We need to stop talking about averages and start talking about subgroups of the population. Adolescent reproductive health is a key factor for progress, younger people, the next generations. The importance of working with partners for development, going out of our comfort zone and liaising with other constituencies. The issue of global, regional and global initiatives are very important only, in my mind, if they support national plans and national programs. Otherwise, they are not as effective as they could. And the fact that South-South platforms for knowledge sharing, information sharing, research sharing, to strengthen health system and learning from others on the experiences, both positive and negatives, are essential. And this is something that in that Manila meeting was highlighted and is going to continue to be implemented over the next few years. Thank you very much.